Fillings fill in holes and crowns make teeth stronger. You guys, I've been excited to talk about this one because I get this question constantly. You know, when do we decide to do a filling and when do we decide it should be a crown? So that diagnosis depends on two important factors. The first being how much of the tooth is affected by cavity or break. So if it's more than half of the tooth, then we're looking to do a crown because we have to make that tooth stronger. If it's less than half, then we can go ahead and do a filling because all we have to do is just excavate the decay or portions of the break and then just patch it. The other aspect is it a functional area of the tooth? Now, the main areas that are functional, if we're looking at the tooth from the side, would be here and here. And then if we're looking at it from the top, we're looking at those four corners essentially, here, 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 and here. So if we have a break or a cavity that undermines one of those areas, then we're looking at a crown. If we have a cavity or a break that's more in this region, in the center, or the side, then we're looking at, yes, let's just excavate that decay, patch that break. We can just do patch, we fill that in. We don't necessarily need that tooth to be stronger. If it's a functional area, that's an area where you've got load bearing. That's where you're actually chewing on. So if we go ahead and just do a filling in that area, now we have a compromised area of that tooth and you've got constant pressure. You're chewing thousands of times a day, putting pressure on that area. And if that goes ahead and breaks, which often happens when we do a filling and we should have done a crown, we have an increased risk of fracture. And a lot of times those fractures go into the nerve of the tooth. And then we're looking at doing a root canal and then a crown anyways. Or in some cases, that tooth will actually break to a point where we cannot save that tooth. And the only thing that we can do is remove it, place an implant, or do a bridge. Difference between an implant and bridge, that's a whole other conversation, which we'll get into on another day. And then, so if you can think about a crown as being a helmet that goes over the tooth, what we do is we excavate the decay or the cavity, we smooth the tooth out, and then we go ahead and either mill in the office a cap, crown, same thing, that goes over that, or a lot of times we send it out to a lab and then they either make porcelain, metal, gold, or the newer version would be zirconia. So you guys, if you guys think you need fillings, cavities, or crowns, anything at all, please give us a call. We would love to see you. We do free exams, free x-rays. Check us out on Google. Check out our reviews. They speak for themselves. You know, we do everything we can to make sure that you have a pleasant dental experience. So you guys, call the number to the left or just click the link. We would love to see you. Have a good one and thank you guys for watching.